Health officials in the U.S., Paul, say they're closely monitoring a second patient that may be infected with Ebola just a day after the first case of this virus was confirmed in that country. Fears are running high, and this could spark an outbreak outside West Africa. What's the current situation?
Well, the director of Dallas County's health department said Wednesday that the second person is under strict observation, but he stressed there is no risk to the public since the virus was contained. This fresh alert comes as Thomas Eric Duncan was confirmed by the U.S. Centers for Disease Control and Prevention as the first Ebola patient on American soil. Federal health officials say he first picked up the disease while living in Liberia, raising concerns of inadequate health checks at international airports. However, Tom Kenyon, the director of the CDC, said it was more evidence of the global nature of the health threat.
This was not a failure of the screening process at the airport. It's one of the realities that we've pointed to with this epidemic being so big and so historical that it's inevitable. The longer this epidemic exists, the bigger it gets, the greater the risk of importation events like we've just seen.
Duncan was reportedly not sick during his flight from Liberia to Dallas last month. Hospital officials say his condition has been improving since he was placed in isolation on Sunday.